While some of us may thrive on stress, others report its negative effects on their health. Stress can lead to physical and mental health issues, and we all could do with some tips on how to stress less. So joining us now is author, podcaster and holistic health advocate, Dr Ron Ehrlich. Welcome, Dr Ron.
Thanks, Fiona.
Now, I know you have a philosophy about 5 stresses and the 5 pillars of health. Can you talk to us a bit about that?
Sure. Look, I think most people today acknowledge that stress is a big part of their life. And I think in order to solve a problem, it helps to know what that problem is. So a model that I've used for the last 35 years is that stress is anything that compromises your immune system and challenges your health. And so looking at 5 stresses, they would include emotional, environmental, postural, nutritional, and dental stress. So they're the 5 stresses, and people say, well, we can talk about the dental stress, but they're the 5 stresses, and that's, once you've identified them, minimising them is the key, but you've got to know what they are first.
Well, I'm just thinking, like with mums, the stress would be the children, so how do you minimise it?
Yeah. Well, that leads to the 5 pillars, and the key to dealing with those stresses is to build resilience. And in order to build resilience, again, it helps to know what you're working with. And so there are 5 areas that I believe you need to focus on, and that is sleep, breathe, nourish, move, and think. And so, you know, if we identify the stresses, we can minimise them. If we want to build resilience, we need to focus on the pillars of health.
I mean, you're talking to the preach, like we all know people say, as mums, get some sleep when you can.
Yeah.
But how do you apply that when that's really not the situation for a lot of mums?
Well, you know, I put sleep as the first pillar because it is without a doubt the most important. You know, and this applies to newborns as well as people of any age. A consistently good night's sleep is a function of both quantity, getting enough sleep, and for over 90% of us, that's 7 to 9 hours a night. And the second part is quality, breathing well while you're asleep. So, you know, there are keys to that. The first one is to prioritise it and recognise it for its importance. But for young families, as well as for everybody, routine is the key. And I remember when my daughter was born, and she's now 32 years old, the best advice I ever received was from a paediatrician who said, the thing you have to do is to teach your child to sleep. And of course...
How do you do that?
Well, that's a good question.
How do you do that?
And we ignored that.
Because they're thirsty. They're hungry.
Well, that's exactly it.
Come sleep time.
And that is exactly it. You need to backtrack into good sleep hygiene and understand what that is. And that's a function of routine, of food and drink, of light, of noise. But it's a routine. And you need to stick with it. I mean, with young kids, and we've now got a 3-year-old and a 3-month-old grandchild, that is also, I'm aware of the challenge. But that is the key. Sleep is an important pillar.
And even the environment. So maybe turning the lights off, some practical tips. Turning lights off.
We need darkness.
Quiet time.
We need darkness. We need a cool room. We need no noise. We need to not be exposed to screen time. I know you were talking about screen time, but the blue light from screens affects our melatonin, and that affects our ability to sleep, not to mention being really wired. You know, being wired before you, literally, mentally, physically being wired before you go to sleep is not conducive to a good night's sleep. So this is why prioritising it and developing a good sleep hygiene is really important.
Can I ask, so I definitely agree that these pillars are fundamentally important to stress. But if you have 2 people and they are both sleeping well, eating well, doing everything that they can, you put them in a situation, one might thrive and the other might have a nervous breakdown, you know? So what is it that differentiates people? Like, obviously it's not just a physical thing, it's a mental thing as well. And how can we adopt that kind of a positive mindset in a situation? Yeah,
well, you know, one of the things about health, I often said that the health is really simple apart from 2 variables, and that is the people are individuals, small point, and everyone reacts differently, and your health practitioner is also an individual, so the advice you receive is always a bit different and confusing. So it is a question of how different people respond to different situations, and I guess that is a personal thing, but that is why building resilience is so important. If you've had a consistently good night's sleep, then you will be feeling emotionally a lot more resilient to deal with the stresses of modern life. If you've missed out on sleep, you won't.
How can you build that resilience? that you talk about?
Well, again, I think the focusing on the 5 pillars is the key, and it's a work in progress. You know, I mean, I'm aware of all of these things, and I'm not going to sit here and tell you I'm perfect. I know that may surprise you, but you know, so you know, that's a work in progress for all of us through our lives. It needs constant vigilance, and sometimes you fall off, you know, the wagon, and you've got to get back on again, and you've got to be listening to your body. I think that's really important.
And that's so important because you actually mention about our dental health as well.
And postural as well.
And
that
postural.
was really
And breathing. I loved the micropore. I loved it.
Well, okay, how long have we got? How long have we got? Well, the dental. Okay, very quickly. People say I include dental stress because my background is dentistry. I don't. I mean, that's one reason, but I include it for anybody with a mouth who is interested in their health and hasn't fully connected the two. And the connections between oral health and general health are profound. So that's the dental aspect of it, and we could talk for hours.
So we should take care of our teeth. We should
absolutely. This is
go into our dentist.
This is about chronic infections, chronic inflammations. It's about sleeping. It's about breathing. It's about digestion. It's about a whole range of things. So it's much more than just are you brushing or flossing.
Right.
So there's dental stresses there as well. You are talking about breathing, and you know, one of the things that we talk about, I ask often, is do you get up at night to go to the bathroom? Or for children, bedwetting is another issue.
Right.
And
is that a sign of stress, is it?
It's a sign of dysfunctional breathing. In many cases, and it's often overlooked.
Right.
So you know, we had a patient that had been bedwetting. They're 12 years old, and they'd been to see a urologist, neurologist, psychologist. They'd been through thousands of dollars worth of treatment. And we recommended the use of micropore tape on the mouth at night to just promote nasal breathing, and that solved their problem. That's about balancing out body chemistry.
That was really interesting when I was reading that.
And you were talking about the postural.
Yeah, postural.
Yeah, posture. Well, posture is a big one. And if you ever are in a public place, I catch the train to and from work sometimes, everybody is looking down.
So true.
And suddenly when you take a 4-kilo head and you put it at that kind of angle, the 4-kilo head becomes about 25 kilos.
Yeah.
So that puts a tremendous postural stress on muscles and airway. Even the way we sleep is a postural stress. Sleeping on your stomach is the worst position to sleep
Is that
in.
right?
Yes.
Should you sleep on your back or on your side, especially as pregnant women?
Yes, side is actually the best. It's the best for a whole range of reasons. Digestion is better, breathing is better, actual mental health is better, believe it or not. So postural stress, and I even include in postural stress how we sit on the toilet, but that's a whole other Well, it is true. It is true. I mean, for literally hundreds of thousands of years, we've squatted. And after, I think it was Queen Elizabeth I, she came up with the first toilet, and that was a great development. And toilets are great. I'm not criticising toilets, but the way we sit on them is also a stress. So there's a whole range of stresses that are involved in postural stress.
So important. Thank you, Dr. Ron. If you want to know how to sit on toilet properly or more tips on stressing less, hit us up on Mums at the Table. But ladies, thank you for the chat. Thank you, Dr. Ron, again. And thank you at home for tuning in. Don't forget to share, like and subscribe if you're watching us at home. Have a great week. Until next time, God bless.